I'm joined here this morning by Melissa Tolan-Halleck from Alpena Regional Medical Center. Good morning.
Good morning.
So, Melissa, I hear February is Heart Health Month. Is that correct?
It is. It is. I'm here to share with you some of the stuff that we'll be doing for Heart Health Month. Heart Health Month is it's an important month for us to really bring awareness to heart disease, and in particular, heart disease with women. We often think of the big chronic conditions such as cancer, and all of those things are definitely worth attention, but we sometimes we call it the silent killer, heart disease, because you don't always know that you have heart disease. You don't always know that you're maybe suffering from heart disease. So really preventative health and awareness are key for this, and especially with women. And statistics really show that women have dying of heart disease is higher rate than all cancers. So if you think of women who die from heart disease at a higher rate than all cancers combined, it's a pretty big thing to pay attention to. And so to bring awareness, we have some different events scheduled. And some of those events that we're going to be focusing on, the Go Red Day, such as the pins that you and I are both wearing right now. We will be giving these pins out at the Health Resource Center at the hospital. And that is this Friday, February 6th, is Go Red Day. So we encourage you to wear red. We encourage you to come in, get a pin, because somebody might ask you, what is that? And that gives us the opportunity to share and to talk about heart health and women in particular. So that's where this originated from, the Go Red. And so we'll give those away, as well as informational cards at the Health Resource Center. You can come in, the first 100, 150 people that come in, we will give pins to you, and we'll also give some little cards that we want you to pass around that really give some tips and some of the signs and symptoms of heart disease in women.
And, I find that interesting because I feel like you hear mostly about breast cancer, as in it makes you think that must be the most common cancer is breast cancer. They put a huge emphasis on that. I feel like they do talk about heart disease and heart cancer, but it's rare.
Right, it is. And and because we've talked so much about breast cancer, I really think that has given us huge leaps and bounds of good outcomes, because we are diagnosing breast cancer, but we're seeing great strides in people surviving breast cancer. So with heart disease, it's not as easy. You don't feel it, you don't see it, there's not a lump. There's not all of those things. And so we're really trying to bring awareness to what some of those signs and symptoms could be. And just really the preventative health, because if you're getting your preventative health, your physician's going to have an indication, and they know the family history, that they want to watch closer. So it's not going to be that silent, all of a sudden it's a problem.
So it won't be as much as a shocker.
Exactly. If we just are aware of our health conditions and follow through on that, that's really the best thing that we can do. So getting the word out is our best message that we can do. And so we'd love to have you participate in the Go Red Day. And we give you the pins, you can pass those around, you can pass out the little cards. And then the second thing that we are doing, I'm really excited about this, it's I'm calling it the first annual because I plan on it continuing each year. We are doing the Heart Health Snow Tour. So it's the Tour of Heart, Tour for Heart. And so the snowshoe event is going to take place on February 21st. It's a free event for all ages, and it will take place by the soccer fields on Woodmere.
Okay.
Behind Northern Lights Arena. And there's a trailhead back there. And so we will be set up there at 1 o'clock on February 21st, free event, and it's going to pretty much be like a heart health community fair that will be outside. We'll have snowshoes for you to use. We'll have 25, 30 pair of snowshoes that people can use if they've never snowshoed. If you don't want to snowshoe, you can walk. And as you stop along the different, we'll have different tables set up and different community members are participating. Northern Lights Arena will definitely be there offering some kind of a sample. The hospital will be there. The cafeteria will be making some free heart health chili, heart health soups. So you'll have samples along the way. Get out and get active. We'll have demonstrations, and we'll have lots of information on heart health. So it's a way for you to get information, get out and have fun. It's a little different twist to our normal community health walks because we're using snowshoes, and we're making it really much more of the education you're going to obtain is going to be as you're walking. So it'll give you, you can stop along the way and get your blood pressure checked. You can stop along the way and try some hot chocolate from Northern Lights Arena. We don't have all the details determined yet, but it'll be a surprise for how many people will members of the community will be participating in this event. And we encourage you to be creative with your Go Red. If you choose to, get creative, have some fun, and come out and try out some snowshoes.
And it sounds like a very healthy and educational walk.
Absolutely.
Everybody's coming together to do this.
Because and the reason we went with this twist is that we know that heart disease and the risk for heart disease is there, but 80%, you can increase your chance of having an issue with heart disease by 80% if you change your lifestyle. That's a huge, huge number.
Yep.
If we just change our lifestyle, and we know exercise and physical activity is the number one way to change our lifestyle. If we can do that, 80% increase in better outcomes with heart disease.
That's amazing.
So if we can do that, and so we are trying to help you do that. We're giving you an opportunity to do that, and you'll be around fun people that want to learn and want to be outside in February.
Perfect. All right. Well, thank you so much, Melissa, for coming on today and telling us about
Thank
that.
you.
I feel like this is very informational, and hopefully people will participate in wearing red this Friday and spreading the word about Heart Health Month.
Yes.
So thank you so much.
And then look forward to Saturday, February 21st.
Absolutely.
All
Hopefully
right,
everybody will make
thank
their way out
you.
to that. Thank you so much.